If you want to be a grade B central government employee, if you want to be a RRB nursing superintendent, if you want to work as a nursing officer in the railway recruitment board. So these are the 5 common mistakes you have to avoid in preparation, students. I am getting lots of messages in my Telegram handle, in my Instagram handle, in my WhatsApp number that, sir, what to study, what not to study. Sir, what to study, what not to study. Yes, students, it is very important to know that what to study and what not to study. So today I am here to give those very important tips for you all for your railway recruitment board examination preparations, especially for the nursing superintendent exam. So it's very basic. You have to understand that you people have the 30 marks plus 70 marks session. It means the 30 marks which are coming from the non-nursing portion, then 70 marks it is coming from the nursing portion. So this is the very basic, students. As all of you know that in NARCET also we are having the, yes, in prelims exam 80 marks related to the nursing and 20 marks related to the non-nursing. So the examination of the NARCET is also, yes, tentatively they have given date on in the April. So there is only 1 month difference. So if you are preparing with a comprehensive approach, you can crack both RRB nursing superintendent exam and AIMS NARCET prelims plus mains as well. Sir, what is the actual practical approach we can follow? Students, cover both non-nursing and nursing subject. Sir, from here we have to cover. So here we have to cover means, for nursing I will tell, then I will come to the non-nursing, because the non-nursing is a key role which decides your rank, students. Okay, so first listen carefully how to cover the nursing subject. So if you are already had the coaching in any coaching institute and you are having the notes, means revise the theory notes perfectly. Okay, immediately after reading that particular topic, you have to solve the multiple choice question from our MCQ books. Sir, I am not gone for the coaching, so I am a beginner. So what can I do? So if you are a beginner and if you know about the competitive books in the nursing, the very basics books we are having as the Target High and PRI. These two are the very basic book. Among these you have to choose one. So my preference is the PRI. We have to choose the PRI. That is the best book for the theory plus MCQ solution. Okay, so this is the PRI MCQ book. So latest edition. Okay, you have to know. So this is the latest edition PRI MCQ book. So this one you can use for your MCQ solving purpose. Before solving the MCQ, the main important is that you have to revise the theory once or twice. Okay, then only it will help to solve the MCQ. Okay, so this is the very basic to how to cover the nursing subject. Okay, so if there is any major subject or minor subject, students, as of the RRB concept, so there is no any major subject, no any minor subject. I have analyzed all the previous year papers of the RRB. So they equally they have divided the portions. They have asked the question from the research, management, anatomy and physiology, medical surgical nursing, pharmacology, psychology. Okay, so every subject they have covered equally. So fundamentals of nursing also, yes, it is the one of the major important component here. Okay, so equally they have distributed the marks. Okay, in the syllabus also they have given the clear cut syllabus that all nursing subject. So in minor subject also there are chance of the asking the 4 to 5 questions. Okay, so major subject if you have to consider means fundamentals of nursing, OBG nursing, medical surgical nursing, okay, and psychiatric nursing. So these are the major subject, and pediatric. Okay, so then pharmacology, pathology, genetics. So these are the minor subject, and nutrition also it will be in the minor subject. Okay, so you have to focus. So then come to the non-nursing portion. It is very important. Many of your question is related to the non-nursing only. Sir, how can I solve the non-nursing? Students, as per my analysis, there are the similar type of the question which are coming in the non-nursing portions. That is from the reasoning, maths, arithmetics, general knowledge. Okay, so the reasoning, maths, and arithmetics, there are the similar type of the question in every exams, like related to the time and distance. Okay, and related to the what we can say is like time and work and number system and all. Okay, yes. So what kind of the questions they are repeatedly asking, like if A and B are doing this much of the work in this time. Okay, B alone can do this work in how many days. Okay, so or like train speed questions, like a train passing 100-meter platform in a 30 second. Okay, so what is the distance traveled by the train? These are the similar questions they are asking in the NARCET prelims also, they are asking in the RRB also. So my concern is, yes, so before directly solving the question, you have to cover the syllabus on the non-nursing questions. Okay, so what all are the syllabus you have to cover? So I will make another detailed video on the syllabus of the non-nursing. What I will tell, that much only how to follow. Okay, prepare for that one twice, thrice. Okay, revise for that one, do practice questions on that particular topic. Okay, so definitely with same to same print it will come in your RRB nursing superintendent exam. I will write and give. Okay, so I will make a separate video for the syllabus. Okay, so here it is not possible to cover. Okay, so next is the don't waste time. The next very important point is the don't waste time. So even you are a working employee, okay, even you are a yes complete aspirant where you are sitting in the room and studying for the competitive exams. Students, there are lots of distractions are there around you. Okay, so there are lots of yes Bollywood movies, Hollywood movies, okay, so coming in front of you. So there are lots of the distractions. It will be continuously coming to you by your mobile. Okay, so while studying, my concern is keep the mobile in the yes flight mode. Okay, so whatever the video want to know about the details, you download that one. Okay, rest of you keep that video. Yes, you keep your mobile in the flight mode. Okay, so it is my suggestion from my side to you all. And unnecessary apps you have to delete from your mobile. Okay, so it is better to stay away from the social media for a certain period of the time during your competitive preparation. Okay, then so if you are not working, so it is well and good. So you people are having the concise syllabus with you, so do revise that syllabus and solve the multiple choice question. Okay, so then next is the proper time management. So what is the proper time management? Many of you are asking like, sir, please make one timetable and give to us. Students, I can make the timetable which is comfortable to me. I can't make a timetable which is comfortable to you. Okay, so whoever the toppers, whoever the achievers, if you are asking means they will tell they have their own timetables. If you are working from the 2 to 8, okay, so your timetable will be different. If you are working from the 8 to 2, your timetable will be different. If you are a night reader, so your timetable will be different. And if you are an early awaker and reader, so your timetable will be different. So make a timetable which is more comfortable to you, and the timetable should and must contains at least 2 syllabus. Okay, so you can't only read continuously medical surgical nursing, you can't only read continuously pharmacology. Okay, so combine those two subjects which is very interested for you, and one more is which is not interested to you. Okay, so combine those two and move on. Okay, it helps to you, okay, to stay tuned with your subject. Okay, so it is very important and basic. Okay, then I have told for the proper time management, again avoid social media for your preparation period of time. Okay, very basically. So fifth point is very important point, that is related to the last minute revision. So what is last minute revision? Last minute revision, so you are having the syllabus like this. Okay, are you able to see this book? Okay, this much syllabus you are having. Okay, this is completely concise syllabus. Students, you are having the syllabus like a huge, so you can't study entire thing in the last 3 to 4 days. That is very difficult. So my suggestion is, now today you purchase one big notebook which is of the 300 to 400 page. Okay, so mention that one as a LMR, that's the last minute revision notebook. Okay, so while teaching, someone you are teaching, okay, so while reading, if you feel it is important, write in the last minute revision notebook. And yes, just 3 days before the exams you have to study only last minute revision notebook. Okay, it should contain all important topics like antidote, like blood transfusion golden point, like breastfeeding golden point, like heparin golden point, anticoagulant golden points. Like this you have to make. Okay, so why? Because these are the very important topics that will repeatedly strike in your exams. Okay, so that one, if you are very fit before going the exam, means so your 70% of the marks are fixed here. Okay, so then you have to only fight for the 30% of the marks. In those 30%, if you are scoring only 15%, your rank will be in your hand. Okay, so this is the last minute revision strategy. Students, okay, take a notebook, keep a name for that notebook. Okay, so your ideal is like Rocky, so you can write the Rocky notebook. Okay, it should be like a gun. Okay, so it should be like a gun where you are firing at the last minute, so it will improve your strength. If it should improve your motivation, and it should feel you to make a have read everything. That kind of the creativity you should involve in the last minute revision notebook. That kind of the mnemonics you should involve in the last minute revision notebook, students. Okay, so no need to be in the stress. Okay, no need to be in the like distractions. Okay, so the last minute revision notebook, it will definitely helps you to strike your questions and strike your rank in the exam, students. Okay, this is a very important suggestion my side. Okay, so still if you are having any doubts, so do comment in the comment box. And while watching my video, especially in the YouTube, okay, I'm repeatedly telling you, make a notebook, separate notebook, that is last minute revision notebook. While I am teaching you, I am telling this is a 10-star point for you all. Yes, how many times I have repeated? I'm telling this is the 10-star point for you. That particular point definitely help you to solve the questions. Even if it is even if it is not a direct question, it will help you to eliminate the other options in the question, students. So that's what I am telling. This is the most important. This is a 10-star questions. This is a 100-star questions. I am repeatedly telling because that is the most important. That will help you to make a grade B. Yes, central government employee. That is help you to make a nursing superintendent. Okay, so that is helps you to make a nursing officer in the AIMS. Okay, so that is helps you to make a a good salary of the 1 lakh per 1 month. Okay, so that is the very important. Okay, so while watching the videos on the YouTube, I am not telling to watch only my videos in the YouTube. So you have to feel this in this particular channel. The wastage of time is less and the content is more. The wastage of time is less and the content is more. That kind of the videos you can watch. Okay, that is only gives helps you in the exams. Okay, so you watch my videos, even a single minute or even 30 seconds, if you found wastage in my video, so just report to me. I will cut that point. Okay, so only syllabus, only motivation, only a marks and selection related things will be going in my YouTube channels. Okay, so the in every day morning 6:30 a.m. the master nursing classes will be in front of you with those very important questions that will definitely strike in your exams. Okay, so here I am covering the syllabus wise. Okay, where I am coming the concept wise, where I am bringing the questions. Okay, everything's in a center point. Okay, that will fires. Okay, that will fires. So this is the suggestion from the master nursing classes. Soon we are releasing the crash courses for the RRB nursing superintendent exams and as well as the test series. So I am getting the lots of the questions that so what to practice. Students, stay tuned with the master nursing classes. We are launching our own app in that one. So the team of the AIMS nursing officer and the team of the SGPG and JIPMER nursing officers. So collaboratively, we are bringing a subject expert for the only for the test series. Okay, not for making the videos, at least a test series. A subject expert will work on the test series. He will give the rationale for each and every questions. So never before in the nursing world and never after in the nursing world. That kind of the test series will come in front of you all. Stay tuned with the master nursing classes. Soon we will be on the field. Okay, so stay tuned. If you have any doubt related to RRB nursing superintendent exam, do comment in the comment box. Okay, फिर मिलेंगे. जय हिंद, जय भारत.